Great. Hi, everybody. I'm Victoria Van Thunen. I'm the nurse practitioner with the Endometriosis Center, and I am so thrilled for all of you to be joining us tonight. Also, I want to make mention that March is Endometriosis Awareness Month, and I'm really excited to introduce our webinar guest, Annie Kaplan. Annie, thank you so much for joining us tonight.
Thank you for having me.
Of course. So if you wouldn't mind just giving us a little bit of background about you and what you do here and a little bit more about the Integrative Health Program.
Sure. My name is Annie Kaplan, and I am one of the nurses. I'm one of the team members of the Department of Integrative Health. I'm a registered nurse. I'm also a board certified health and wellness coach. I'm a Pilates instructor. For over 25 years, I had a Pilates business in California, moved back to the East Coast recently, about a year and a half ago, and I'm finishing up a master's in mindfulness studies at Lesley University. So I'm happy to be here. I'm very excited to be a part of this webinar. So I'd love to tell you, I'm going to just pull up my slides, share the screen, tell you a little bit about our team. Okay, can you see my slides here?
Yep, I can see them.
So our team is made up of, there's about 14 of us in our integrative health team, and we're made up of nurses, acupuncturists, massage therapists, holistic health coaches, and Pilates and yoga instructors. And our what we do is we bring conventional and complementary approaches together to take care of the whole person and promoting and restoring optimal health. And the purpose of our department is to bring pain relief, decrease stress, decrease anxiety, improve sleep, and improve overall well-being for the patients. Just want to tell you a little bit about some of the offerings that we have and some techniques that we have to decrease pain, anxiety, stress, and help with sleep. One of the things that we offer is mindfulness, and just a definition of mindfulness. It's paying attention on purpose without judgment. And a lot of our therapies here are mindfulness based, really, that like mindfulness is kind of the umbrella for a lot of what we do. So I'll kind of give you an example as I go through each of these so you have an idea. So mindfulness is, I'm sure all of you have driven to work one day and realized, I don't know how I got here, or drove to the grocery store and say, I don't remember driving here. So that's not being mindful. So mindfulness would be being aware of like getting in your car, putting your hand on the steering wheel, knowing that you're driving there, being aware of your environment. So, and that's something that you can take away and do every day, from waking up and having that first cup of coffee and getting that, grounding your coffee beans and just getting that right cup to put your coffee in, and just feeling the weight of the coffee mug, and then the smell. It's using all of your senses, and just that first sip, like, right, we all remember that first sip, or tea, whichever you drink in the morning. So that it's just an example of something you can do with mindfulness every day. Maybe it takes 5 minutes. There's so many studies that show just 5 minutes of mindfulness can really change and decrease anxiety. The other thing you could do even while you're in the shower and just kind of shampooing your hair, and like just being mindfulness of your fingers touching your scalp and how that feels, and just the soap and the smell and the water, and just bringing awareness to all of your senses. The other, one of the other things we do is guided imagery, and that's visualizing positive images using all of your senses. So that's the same thing as if there's your ideal place, a place that you love to go to. So It's an effective way to decrease anxiety or get you out of a stressful situation, if you can, and think about, or pain, is to think about that ideal safe spot. And again, you're using all your senses, or maybe it's a garden that you love outside of your house, or a room in your house, and you describe it like you describe the windows and the color of the paint and the smell in the room and what the furniture looks like and your feet touching the floor. And so you're using all of your senses, and the temperature, or if you're outside, it's like feeling that sun touching your back, or maybe the wind or breeze on your face. So that, again, is using all of your senses. Another technique we do is M technique, which you've had massage before. Like a tickle, we would say, is like a 1. And on a scale of 1 to 10, a tickle would be a 1, and a 6 would be a Swedish massage. So for M technique, the pressure that we do with that is about a 3. So M technique is a series of strokes and light pressure that we do on the body or on the hands and feet. And for patients in the hospital, sometimes they just prefer to do hands and feet. And you do everything in a set of 3. So you would do some linear movements of the hands out to the sides, and you flip the hand over and do the same. And then you'd circle around the knuckle for a series of 3. Of 3 strokes, and patients have said that I've had patients that have asked me in the hospital that I've done that, and have asked me to come back the next day because it's been helpful for them to relax and sleep at night, that they've had like the best night's sleep that they've had, and or they hadn't been able to sleep in the hospital for 5 nights, and then after they've had the M technique, they just felt that was something that helped their body relax. Another modality we have is progressive muscle relaxation, which is tensing up a muscle or muscle group and then relaxing that muscle group at a time. So you would like tense up, like for an example, tensing up the muscles in your hand. So kind of making a fist and holding it for 5 seconds, and then releasing it for 10 to 20 seconds. And then just being aware of how that feels, that relaxation. And then you kind of move up the arm and think about tensing the muscles in your arm, or then your bicep, and then relaxing that, and then letting that release for 10 to 20 seconds, and just noting how that feels. Another modality is Reiki. So Reiki is a Japanese form of energy work, where we move energy through the chakras, and just it's a balancing of the body, and we do start with the head generally, and touching the head, and then we kind of hover over the body for the rest, and then we'll lightly touch the feet as we finish and exit. So it's moving the energy through the body from the head through the feet. And then we have quite a few modalities here, so I'm sorry I'm going on. We also have relaxation breathing, and there's so many different relaxation breaths that you can do, but a common relaxation breath that some of you may have heard of is the 4x4 box breathing. So you would inhale, breathe in for 4, hold that for 4. So the end of the inhale, you're holding it for 4. You exhale for 4, and then you hold it at the end for 4 breaths. Another is breathing. You can just breathe in for 5, and then exhale for 6 or 7. So you have that longer exhale, triggering that parasympathetic nervous system, which just helps, when you have that fight or flight, that just helps you relax, triggering the vagus nerve. Then we have therapeutic touch, which is also another energy practice like Reiki, but it is a hovering of the body. So it's balancing the energy field. So usually with therapeutic touch, it's a hovering over the body. You're not touching the body. And then there's meditation, and meditation is a practice to bring awareness and focused attention, and you can meditate on different senses. You can meditate You can do a loving kindness meditation. You can do a self-compassion meditation. There's just a lot of different meditations that you can work through and that are very helpful. There's also things like supportive touch that I didn't mention in here, and that is, just putting a hand over your heart, or two hands, and just sometimes when you're really stressed, just having that contact, just that contact with the skin, just triggers that relaxation response. And that could be, it doesn't have to be on your chest. It could be just bringing your fingers together and connecting, putting your hands in your lap, connecting finger to finger. It could be crossing your arms, anything that you feel that just may just help give you support. So that's also another option. Okay, so moving along. If anybody has any questions while we're doing this, you feel free to stop me at any time. Just want to talk about some of the research that's out there. And there's a lot of research in the modalities that we offer, but I didn't want to overwhelm and do too much. So I just picked out a few recent studies that have been out there. And there's a study by Ragnar and Zeiden that was done in 2022 in the Journal of Pain Journal. And they were looking at introducing mindfulness meditation in a hospital setting for patients that had sorry, I just had a hip replacement. So they were looking at reduction in pain here. So what they found was that that after they had a few different, they had a control group and a group that they introduced mindfulness meditation to. And they found that there was a reduction in pain after the mindfulness training. They did four sessions, 20-minute sessions, and they randomized into two groups. And the patients that had the 4 20-minute sessions, they saw a 32% reduction of pain. Also, there was a recent Reiki study done in 2021 in the Journal of Holistic Nursing, looking at the effects of Reiki on pain and anxiety in women that are hospitalized for obstetrical and gynecological related conditions. And with that, they saw a 92% reduction in pain, a 96% reduction in anxiety, and a 91% reported lingering effects. And these were patients that each patient that was admitted was scheduled. They kind of like a consult service, apparently, that they, kind of like our integrative health service, where they had they were scheduled for a Reiki session, and they had a huge effects on the reduction in pain. And as far as the reported lingering effects, they didn't measure, but by the time of discharge, they felt that they still had a decrease in pain and decrease in anxiety, which was evident by their the decrease in their pain medication and their anti-anxiety medications. But that, like for future study, but that's something that they noticed. There was a lingering effect, that they would look at that and see, how far out that the effects lasted. So. There's also a study done in 2015 on M technique, looking at the effects of guided imagery versus M technique, and for pain in joint replacement patients. And they saw a significant reduction in pain and anxiety with the M technique. Interesting, they also did see a reduction in anxiety with visualization, but there was more of a reduction in pain in this particular study with the M technique. Okay, so moving on. So the other thing I wanted to mention that we do, and I didn't put that in the other modalities because this is kind of a separate, something else that we do is called prepare for surgery. This is something that we offer to patients prior to having surgery in the hospital. It is a technique that was developed by Peggy Huddleston. And Peggy Huddleston is a psychotherapist, a researcher. She's a graduate of Harvard Divinity School, where she studied individuals where she studied emotional and spirituality and looked at their speed of healing. So she is in the Boston area, and she's done a lot of studies looking at prepare for surgery, which is a relaxation technique that she uses. And I'll go into a little more detail here, but it's a 5-step process of visualizing your healing. So the first step, what she does is offer a relaxation recording. So she recommends that you listen to this recording 2 times a day, and that's the first step. And in this recording, kind of how we spoke before, a lot of what she uses is visualization, and kind of how I mentioned in the beginning of the modalities that we offer. She talks also about finding kind of your ideal place, right? So as you go through this relaxation, finding that place that you feel safe, using that visualization of that ideal spot. Like I said, maybe it's a garden, maybe it's a spot in your home, wherever it is that you feel good. And that's one of the techniques that she uses. And then the second step in the 5-step process is visualize your healing. So she recommends 3 endpoints. So the first endpoint is how you would feel immediately after surgery, after you are in the recovery room, and how you would feel, how you would want, visualizing how you would want to talk to your loved one or to a friend that's there with you. So maybe it's that, I'm just going to give an example, maybe it's that, feel great, I'm comfortable. And all of it is positive phrases. It's nothing, you don't want to bring negative into it, where you don't want to say like, oh, I don't need pain medication. It's, you don't even go to that step. You just talk about, I'm feeling comfortable, or I'm holding my partner's hand and I'm feeling loved and I feel wonderful that he's here or she's here with me. And that's the first endpoint. And I know there's a lot more to this, but I'm just going to kind of give a brief overview. And then the second step is visualizing yourself when you get home, and maybe that's 2 weeks after surgery. And maybe, if you like to cook, maybe you visualizing yourself cooking a meal in the kitchen and what that feels like. And, I feel strong standing at the kitchen counter, and I'm cutting vegetables, and I'm using garlic or spices that I love, and just enjoying or noticing that whole process again, every sense, in a place that you feel good, so you feel good, and I feel healthy. Those would be the positive affirmations that you would want to bring out in that endpoint. And then the third end result is how you feel when you're completely healed. So maybe it's, I'm going on a hike with my dog and I feel strong, and I'm with my spouse or I'm with my best friend and I feel great. And that would be the third endpoint. So those are things that you, as you go through the process, she also has a book that describes this, but as you go through it, you would develop this, and you come to these endpoints before you go for surgery. And then the third step is to organize your support group. So your support group is your family, your friends, and let them know that you're going to be having surgery maybe in 2 weeks, and you're having surgery in 2 weeks, and your surgery is on such and such a date, and I am going for surgery at 9 a.m. So at 9 a.m., all of your friends will, and you'll let them know that you're favorite color is maybe yellow, and so that they can wrap you in a blanket of love and support at that time. So you kind of have your whole support system organized before you go in for surgery. And then the fourth step are the healing statements. The healing statements are something that you would give to your anesthesiologist when you go for your pre-op appointment. It would be something you would give to your surgeon or the OR nurse, that when you go into the OR, something that you tape to your gown as you go in. And the healing statements are what the anesthesiologist would say or the surgeon would say when you first get in there. The first healing statement is, following this surgery, you will feel comfortable, you will heal well. And then towards the end of your surgery, they would say, and they repeat these 5 times, and then towards the end of your surgery, they would say, your operation has gone well, and following this operation, you will be hungry for blank, and maybe it's, you would say, like, if you like chicken broth or apple juice or like some clear liquid, you would put that in there with your healing statements when you give that to them. And they would say that, and then following this operation, you'll be thirsty and you'll urinate easily. So that is all part of the healing statements that you supply to your anesthesiologist, to your surgeon, and also bring to your pre-op appointment before you go in for surgery. And then that is organizing that, and then your step 5 is meeting your anesthesiologist. So, and that's something that she recommends that you want to meet before in your pre-op, so that you feel comfortable, that you have these healing statements, so you feel comfortable about talking about what the process is and how the surgery is going to work. Because we know there's been so many studies out there that have looked at just preparation alone for patients decreases stress and anxiety. There was a meta-analysis study done on over 8,700 patients, and that was done at 191 different centers. It was a meta-analysis, so it was 191 different studies that they looked at, and they found that patients that were prepared for surgery had improved outcomes such as decrease in pain, decreased surgical conditions, decreased surgical complications, and decreased length of stay. So we know that preparing the patient and if you have any questions, and having all of that whole process answered before you go in for surgery, it's helpful for you as you go into surgery, and then also as you heal from surgery. There's also, I'm going to go on to some studies that she has done with prepare for surgery that Peggy's been involved with. And there was a study by Waters and Feldman, which was a pilot study that they did on colorectal patients at the Leahy Clinic, looking at the power of relaxation on the preoperative patient. And they found that there was less pain, 60% less pain medications that they needed. There was less anxiety, less irritability, and less insomnia. They also they were discharged sooner. I believe it was 1.6 days sooner than the average length of stay. Also, there's a study done by Phillips et al., and that was at a Beth Israel Deaconess Medical Center. It was a pilot study for a randomized control trial on the effect of guided imagery in hospitalized medical patients. And also in this study, it was a pilot study. It was only done on 23 patients, but they found that there was less anxiety, and also and that was evident by needing less medication, and also less heart rate variability in the study. So, and I'm I'm going to just close out of this. And then I'm going to move on because I want to show you, if I can. I'll stop sharing this. I'm sorry. I'll do that. So I want to share something else. Bear with me for 1 minute. Can you see the screen now?
Yep, I can see it perfectly.
Okay, so I wanted to just mention how to access surgery care plan here. So if you have your NYU Langone health app, you can go to your health app, and just under the to-do feature, there's a tasks that are included, and there's reminders, education questionnaire. So if you go under the to-do and you click on there, you'll see that there's some relaxation strategies here, okay? And here are I just want to show you what is available to you. So there's breathing exercises, there's mindfulness meditation, there's a relaxation guide. Also talks about, there's a link to our integrative health department and what we offer. There's some recordings, a 2-minute gratitude meditation. There's also a guided imagery meditation. And then there's also a page here with also a link for different breaths. So there's a lot of relaxation breaths that you can see on here. Focus breath, exhaling with intention, breath count, the square breath that I mentioned earlier, the diaphragmatic breathing breath. And then it talks about tips for mindful meditation. There's, I was talking about bringing it to everyday life, even hand washing, right? Just doing a mindfulness hand washing. And then there's also the 5, 4, 3, 2, 1 grounding meditation that's on there too. And then how to contact us. This is our email here. You can see our phone number. You can call us. And this is, most of our services are done for inpatient, but we have worked with patients. If you call us, call our number or email us, and you want to do some meditations on the phone, or you have some questions about different modalities, we're happy to talk to you. And we're hoping to have some outpatient group offerings in the future. That's something that we are working on. I'm just going to close out of the slides and stop sharing, and then open it up if anybody has questions or anything.
Well, that was fantastic, Annie. Thank you so much for sharing all of that.
Sure.
Kiara, were there any questions that came through during Annie's presentation?
I have not gotten any. Yeah.
Okay. All right, well, we can wait a little bit longer. While we wait, Annie, I'm not sure if you wanted to maybe share some of your own experiences with patients that you've worked with in the past, in really any of the modalities that you've been able to integrate into their care.
Sure. Yeah, I'd love to tell you a couple of stories I can share. I can share you an example of visualization that might be helpful. There's a patient that had a torn rotator cuff, and she needed surgery, and her surgeon said it was like she had torn, like they looked like torn pieces of rope, and she thought, oh, there's no way. I know if you tie a bunch of ropes together that's not going to be strong enough to support my shoulder. So she went and had another meeting with the surgeon, and was told, well, actually you have a strong bicep, and we're gonna visualizing that strong muscle and supporting, and that's going to be attached. We're attaching that to the shoulder, and you're strong, and that just gave her, that visualization made it much easier for her to go into surgery, she said, and feeling better about going in, that she had that support. And that's just an example of like what visualization works for you. And also, if you have questions with your surgeon, and that's a great kind of preparing for surgery, or in any question in healthcare, right? If you just don't feel comfortable with how it looks, or what the process or procedure is, that you maybe need a different visualization for yourself, for that healing process. I've had patients recently with working with M technique that have. I had a patient that was in the hospital for probably 7 days. It was a transplant patient, cardiac transplant, had not been able to sleep, was on, a lot of immunosuppressive medications, steroids that kept them up at night. And so when I met with her, I did M technique just on her hands and her feet. And she had asked the nurse if I could, requested that somebody from our team come back the next day, because she said that was like the best night's sleep that she had since she'd been in the hospital, that she was able to finally just relax. I had a patient that I did Reiki on, was a post-op surgical patient who had a lot of edema, almost a pitting edema from his hips all the way down to his feet. And I did a lot of Reiki focusing on that area as we got down. And I saw him 2 days later, and he had said that after the next day, most of his swelling went down, and he felt like it was related to the Reiki, because that was the only thing that was different. So then he just felt like so much lighter without that weight of all that fluid. And then he just continued we kept him on our service and wanted to see us. And then when he had to come back in for another procedure, we followed him as well. So, and that's something he ended up incorporating once he went home. He found a Reiki practitioner that he worked with. And also Reiki is one of those modalities that you can also practice on yourself too. So.
Yeah, that's great. Kiara just sent in a message from one of the viewers, and they're asking, do you need a referral to receive the integrative health services at NYU?
You, as an inpatient, you need a referral. Yeah, you can call, and then if you've been if you're an inpatient and discharged, you can call. You don't need a referral for acupuncture as an outpatient, what we have right now. And you can always call our department, call that number, or email if that's more convenient. And you can just talk to us and we can help if there's modalities that you need. But as an inpatient, it's a referral. Yeah.
And just in case anyone viewing this is wondering, all of the pre-op patients would qualify for the Prepare for Surgery program. Is that correct?
Yeah, absolutely. Yeah.
Excellent. So I encourage any patients who are considering surgery or are booked for surgery to speak with their surgical team if they are interested in utilizing that resource. I guess we could give it a couple more minutes just to see if anyone else has additional questions. I thought the research that you posted about was really interesting because there's such a interconnection between pain and anxiety. It's almost like the chicken and the egg. It's like, which one comes first?
Right, exactly. And there's also, and that's also with inflammation. I know you'd asked me about that before. I don't think I mentioned it tonight when we were talking, but there is a lot of up and coming studies looking at inflammation and mindfulness practices. and looking at things like interleukin-2 and C-reactive protein, and that they're seeing that it does affect these inflammatory markers, and that it may be helpful for inflammation to do mindfulness as an anti-inflammatory process to help with that.
Yeah, it's just so great too, because you can do all of, I mean, not all of them, but many of them from home.
Absolutely.
Practicing. I know that they have a whole bunch of different apps, I think, on the market where you can time your meditations in the mornings or the evenings or whenever you choose to do it. They're all really good.
The other thing with, I think a lot of times people with meditation get so intimidated, or they say, I can't do it because it's all focused on breath, and it doesn't have to be breath. The first time I meditated, I felt like I got short of breath because I was constantly focusing on my breath. So I would put my hand on my dog, and I would breathe with him, with his breath, and I thought, oh, that was so relaxing. So it doesn't have to be like, you can meditate so meditation, you want to have an anchor. So that's why a lot of people talk about having breath as an anchor. But it can be a sound in your room, like a fan, if there's a humming, or like music. So you put music on, and that's your anchor, using music. It doesn't have to be breath. And so an anchor is just a place that that you bring your focus to, right? So it doesn't, our mind is going to wander, or we're going to think about other things. And that's just part of the process. That's like, and that's where that non-judgment comes in. You just want to say, okay, yeah, I just thought about that worry, or I was thinking about my list, or worried about this, or, and you kind of just note it. And same thing with pain, like, oh yeah, I'm having, pain in my belly, or I'm pain in my hip, and I know it's there, but I'm going to go back to my anchor, whether it's music, whether it's breath, or, maybe it's a smell, maybe it's a scent, maybe, somebody's cooking, and your anchor that for that practice is has to do with your scent. You're using that, for your anchor.
Hey, Kira, did you get any other questions? Oh, yes. Are these services specific to adults? That's a great question.
It's a great question. And right now, yes, we're working only with adults right now. Yeah.
And what is the adult age cutoff? Just so
Probably 18 and older.
18 and older. Okay.
You can use these modalities in children, absolutely. And I don't have that data to share with you.
Sure.
You can. It's just that our department right now is not working in pediatrics. I mean, we do see people in OB, but we're not, we're seeing, but we're not seeing children. Yeah.
And I know that you had mentioned it earlier, but we are trying to put together an opportunity for there to be more of an integrative health presence, at least I know in this office. So as soon as we have more information regarding that, hopefully we can start rolling it out to the patients that are interested in
Yeah, we're trying. There are a few things that we're looking to offer, to do some group support, which is great to have that commonality and support each other. And so we're looking at doing some, possibly a 6 or 8 week group series, and also some a mindful movement series as well. So that's in the works. We don't have anything set for dates or anything like that, but I'll absolutely let you know, Victoria, when we do.
Yeah, absolutely. And then talking about the group sessions just made me think of another question in terms of the Prepare for Surgery program. this is typically done in a group setting?
It doesn't have to be. We can do it in a group setting. There are some surgeries that we are, if there, or there may be 3 or 4 patients that we can do it together. You can absolutely do it in a group, but we'll also do it one-on-one, and doing it over the phone right now with patients that are one-on-one, or in group doing it, by Zoom. But both, you can do it. It doesn't have to be just a one-on-one.
And we can do those virtually and in office, or are you just doing them exclusively
We're
with
doing them
virtual?
virtually right now. Yeah.
Sure. All right. Well, we are coming up on time. I don't know if there were any other last minute questions from any of the attendees. I think that might be all for tonight. But if anyone does have additional questions, they can feel free to reach out to me or any of the other providers within the Endometriosis Center. If we don't have the answer, hopefully, Annie, you can serve as a resource for us.
Absolutely.
In the future. But thank you again so much for preparing this presentation and walking through all of the different modalities that are readily available for patients at NYU.
Thank you for having me. I enjoyed being here.
All right. And with that, we will sign off. Thank you so much, everybody.
Good night. Everybody have a good night. Bye-bye.
Good night.